Hey guys, I am back for the second part of. Hold on, grab the wall. Hey guys, so this is my. Hey guys, so I am back for the second part of Abnormal Psychology with Mona Vanderwaal, but this time we're talking about her treatment. So, just a little recap. She's a character on Pretty Little Liars. She becomes pretty much the main enemy and bad person of the whole show. She's she tortures the girls, and blah 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 blah. And so she gets put into Bradley Sanitarium, which is a mental institution, and she's there for 5 months. And so whenever they let her back out into the world, they believe she is ready to get back to a normal life, and she has understood how to how to adjust herself in various situations to keep her diagnosis and disorders healthy. So, Mona's diagnosis. I diagnosed Mona with 4 things, with them being antisocial personality disorder, paranoid personality disorder, dissociative identity disorder, and obsessive compulsive disorder. And yeah, here's just. I went over this in the last video. Basically, it's just relating it to her. And for the treatment, I only did 2 of them because for all 4 of these, they really do showcase Mona, but I wanted to talk about the paranoid personality disorder and the dissociative identity disorder because of the various ways psychologists use these disorders and their treatments to help better improve other treatments. So, PPD, paranoid personality disorder. So, treatment for this disorder is known to be very successful. However, most individuals have trouble accepting treatment because whenever a person has this type of disorder, they are very scared and anxious with the world, and they feel like someone is always out to get them. So, they're trying to make themselves accept treatment, but these feelings that they're feeling are unwanted and unwarranted, so they can't control them. But the types of therapy that have been found to be beneficial to treatment of this disorder are talk therapy, psychotherapy, and psychotherapy. And there's really 3 goals for the treatments, which include helping the individual learn how to cope, helping them to communicate, and reducing feelings of paranoia. And so, just a little history. The treatment for the paranoid personality disorders comes from the psychodynamic psychological perspective. And this perspective talks about this disorder in a way that showcases how many things set into stone are then put together to create like a boulder. It's a metaphor, I guess. And so this treatment is impacted by the findings of individual case studies, advances in medication, and the usefulness of therapy methods for a particular patient. For this treatment, it really is about testing your theory and testing what you want. And then the treatment for this disorder is highly varied because the type of, it's all the same, but the levels that a person feels of this disorder may be different than from what another person feels, if that makes sense. And so treatment can last longer depending on the individual and the diagnosis. And then just here's a short little video. Um, it's a good video, and it talks about the goals and the treatment and the diagnosis of paranoid personality disorder. So, Mona's treatment. Mona can be characterized as someone who feels no remorse for torturing or bullying anyone. She's always able to hide her bad feelings from everyone while outwardly putting on a positive face. I truly believe that Mona needs to undergo this type of treatment because the problems that this disorder has caused her have impacted not only her but the people around her. And three treatment methods I believe would be effective are psychiatric evaluations, medications, and psychotherapy. The evaluations, because even in the show Pretty Little Liars, Mona talked to her doctor and she talked about what was going on. And if she's able to talk to someone, she can then get an evaluation on the disorder. And then medication. Medication has been proven to help treat this disorder very rapidly and effectively. And so I believe that would be a good way to treat this disorder. And then psychotherapy. Psychotherapy. And I also believe Mona should be put back in Radley Sanitarium because I believe that she needs to cope with her disorder because she doesn't really think it's a problem, but it is. She always says that she's out of the A team, she's done being A, but she's never truly done maneuvering and trying to figure out every little detail of everyone's lives. And I think for this disorder, they really need to get to the bottom of Mona's disorder. Like, we know that Mona is paranoid because of the things Allison did to her, but we don't know what these did at an early effect. We don't know if there's any family or social causes that caused it. And I think during this treatment, it would help to figure it out. And then the dissociative identity disorder. Okay, so the DID is primarily treated with psychotherapy, and there's usually, they can be, okay, hold on. The treatments for this disorder can be characterized really into 4 types of therapy: psychotherapy, cognitive therapy, family therapy, and creative therapies. Each of these different types of therapies appeals to a specific patient because whenever someone has DID, they have multiple personalities and identities that they associate within themselves. So they could be one way 1 minute and then completely opposite the next. You have to be able to understand the different identities during treatment or during diagnosis in order to correctly treat them. And then there are 3 levels or parts of the treatment, including stabilization, trauma work, and integration. Stabilization really talks about trying to stabilize the person into being able to accept that something is wrong and that they have multiple identities when they really should only have one. Trauma work works with people who have readily experienced this disorder and understand how it works. And integration starts with integrating people back into society after they've been treated. Sometimes medication is used, although no specific medication is specifically indicated for DID. But whenever people with DID also tend to suffer from anxiety and depression, so medication can help with that. And a clinical hypnosis, I don't know why I couldn't say that word, can also be used in the treatment. And that process includes relaxation, concentration, and an altered state of consciousness. And by putting these 3 things together, the therapist is able to see inside of the person's different identities so they can identify what is best for each one. And there are many goals associated for the treatment, including reconnecting all existing DID alters into one well-functioning identity. Therapists really want, not just therapists, anyone treating a patient really wants them to become a unified whole within themselves, allowing the person to safely express and process painful memories, developing new and healthy coping skills, restoring functionality, and improving relationships. All of these things pertain to how the individual was cut off from society before they were treated because they had multiple identities and didn't know how to control them or healthily or be healthy in their ways to cope with them and keep them in. Okay, so just a little history. The history behind the DID treatment comes from the cognitive and biological perspectives of society. Each of these perspectives tell us through their beliefs how DID works and why it happens. And so the treatment for this disorder is impacted by the extent of the condition, the number of present identities, and the harmful danger of the disorder on the individual and society. These three things are really the deciding factors between little bits and pieces of a treatment. And kind of how the paranoid personality disorder was, the length of this treatment depends on the severity of the disorder. So people do believe that the treatment is considered complete when the person has found a way to manage their multiple identities in a healthy way that keeps them stable in their environment. And so by doing so, the treater has helped them. And then here's just another video talking about it. And then Mona's treatment. Mona experiences DID through her alternate personality of A, which she uses to torture the other girls. I believe Mona's treatment would be a multi-step treatment aimed at understanding what made Mona create this alternate identity. We know that Mona is A. We know that she is also Mona. But through this treatment, I believe we can figure out why she became A and what impacted her choices and all the little details that can fit into place and create a story. And there's my works cited. That's the end. Great. Enjoyed.